This week, doctors are calling attention to a troubling problem among teenagers. This is Eating Disorder Awareness Week, to increase awareness about eating disorders like anorexia, bulimia, and binge eating. And joining me now are two experts in the field. Dr. Gregory Jantz is with the Center for Counseling and Health Resources, and Dr. Brian McKay, a Seattle dentist who specializes in helping eating disorder patients as well. Good to have you both here.
Good to be here.
Nice to be here.
Dr. Jantz, is a problem that affects a lot of teenagers.
Oh my goodness, the youngest we've seen is age 6, but right now there's a new trend, ages 10 to probably 13, younger and younger.
Why is that? Is it just the body image? Is that
Well, I think there is more pressure. I think the girls are growing up quicker, it seems like to me. The body image, there's a lot of pressure, of course, self-esteem. But we're finding younger girls addicted to laxatives.
6 years old? I can't believe that.
That's the youngest. That's a little rare.
That's really sad.
Yeah, but you know, there's another trend of the women, and we're seeing this more and more, age 35 to 40, who are coming in for help for the very first time.
See, I thought maybe with more awareness that the problem would start to get a little better, but you're saying the opposite is the case.
You know, that's what we're finding. Yes.
Dr. McKay, tell me a little bit about the effect that this has on dental problems. You're seeing a lot of dental problems.
Well, especially with the bulimia aspect of eating disorders, the stomach acid emptying into the mouth erodes away the backside of the teeth.
And so we're showing some pictures here of what happens, and I'm assuming this is one of the worst case scenarios, but is this something pretty common in people who have eating disorders?
Anybody that's experienced that for a long time, even 3 to 6 months, is affecting their teeth a lot.
And what can you do for them?
Well, we have to restore their mouth back to function and appearance for emotional purposes. Sure.
But do they have to be cured first? I mean, because then can the teeth just, can you run into this problem again?
If they haven't turned the corner, which is where Dr. Jantz comes in, if they haven't gotten some help and started on the way to getting better, then it doesn't make sense to fix their teeth because the same thing's going to happen over again.
Exactly.
Yeah.
No, since this is an awareness week, let's talk a little bit about what parents, especially teenage girls and young girls, need to be aware of.
Sure. Well, one of the things that we know is that eating disorders are progressive. So once you start on that pattern, the earlier the intervention, the better. It's like an addiction, and it just keeps going and going and going. One of the things, so I think parents, a lot of times this is happening in front of them, they don't realize it. They don't realize that after the dinner table, the daughter's disappearing. I'm saying daughter, but and she's going to the bathroom to throw up, or suddenly, you know, she's trying to hide herself in her clothing. You start to see these changes, and you start adding up this, and you go, you know, there could be a problem here.
So there's no overreacting to this. You should just be on it right away.
I think you should be on it right away because, of course, I see people who wait way too long to get help, and we see that, you know, they're no longer smiling because they're so ashamed.
Well, can dental problems be a sign that I mean, can that be one of the warning flags?
Oh, definitely. Yeah. We send plenty of patients out to the center as they send down as well. We have to, you know, empty the room and say, talk about their habits, because there's a very distinct pattern, a very stereotypic pattern that we see of the backsides of the teeth eroded away.
And then what do you do?
As far as fixing them?
Yeah.
Well, it's the basis is in cosmetic dentistry to restore the appearance, but we have to restore the function so it lasts and they keep their teeth. Sure.
Well,
and then they feel like smiling again. And you know, just build
that goes all the way to their heart too. Sure.
Right. Yeah. Well, I'm assuming that bringing someone's teeth back and helping them feel good about themselves can't hurt.
Absolutely.
All right, we want to show you that you can get more information about eating disorders. Check out the Center for Counseling and Health Resources website. It's a placeofhope.com, and for more information about Dr. McKay's practice, you can go to acld.com.
.com.
All right. Dr. Jantz, Dr. McKay, thank you for being here.
Thank you.
Appreciate it.
Yeah.